Hello. This week we celebrate clinical research nurses and midwives all over the world. And I would like to give you a short overview on clinical research nursing in Sweden. My name is Sabine, and I am the chair of the brand new Swedish Clinical Research Nurse Network. We started in March this year, and I'm also in charge of a local and a regional clinical research nurse network, and I'm the coordinator for a national project group who works with professional development issues regarding clinical research nurses. So, if we get started with some facts about Sweden. Cornerstones of the Swedish healthcare system are the principles of need, solidarity, cost effectiveness, and equal access to care, regardless of socioeconomic status or geographic location. This principle is mirrored in the organization of healthcare in Sweden at three independent governmental levels: the national government, the healthcare regions, and a total of 290 municipalities. Overall goals and policies are set at the national level by the Ministry of Health and Social Affairs, while regions are mainly responsible for hospital or inpatient care and primary care, compared to these 290 municipalities who are responsible for nursing home care, social services, and the housing needs of the elderly, as well as care for the physically and intellectually disabled. I think that the UK's world-leading status in research and innovation is in large part founded upon its networks and accessible research and innovation infrastructure. Sweden is a very large country with an extreme low population density compared to the UK. And to get in contact with each other is really frustrating for clinical research nurses. It's really hard. Until March this year, we did not have a national network, and we are still working with mapping local and regional clinical research nurse networks. Our vision for the future is that the national network can provide a forum which enables information exchange, collaboration, knowledge transfer, and the possibility for involvement in consultation and opinion work. The Nordic countries, as you can see on the map, which means Norway, Denmark, Finland, and Sweden, do not have a separate IRCRN chapter. This is because we do not have a strong Nordic research infrastructure. In Sweden, we are the first Nordic country who has a national clinical research nurse network. Now we try to contact local network coordinators from other Nordic countries to establish a contact network and to learn from each other. Hopefully, this will lead to a IRCRN Nordic chapter in the future. So, how do you become a clinical research nurse in Sweden? One of the basic qualifications and requirements is a degree in nursing. The National Board of Health and Welfare is responsible for the registration and licensing of registered nurses. The license does not have a time limit, meaning that healthcare professionals do not have to reapply to maintain the license. Licensure is applied for by the individual nurse after successfully completing of education and granted without further requirements. Nurse specialists, for example, in surgery or intensive care, do not have a specific licensure. However, the registered nurse title is a protected professional title in Sweden and can only be used by those with particular qualifications. 11 different nurse specialties are considered to have a protected professional title, but clinical research nurses is not one of these protected professional titles. To succeed as a clinical research nurse, you need bedside experience as a registered nurse, at least 2 years, and the GCP certificate. A lot of employers prefer clinical research nurses who have courses in chosen specialty, for example, oncology or cardiology. As I mentioned earlier, has Sweden no certification program nor an advanced academic degree for clinical research nurses. This is on the wish list for the future. Clinical research nurses work in hospitals and other medical facilities, and they work with diverse patient populations. One primary responsibility involving caring for patients, but specific job duties vary depending on employer and specialization. Clinical research nurses assist doctors, provide treatment, administer medication, monitor patient recovery and progress, and educate patients, families, and other clinical professionals. Although we do not have an advanced academic degree in clinical research nurses nor a national competency model, some regions do have locally defined core competencies for clinical research nurses, as you can see here. At my research unit at the University Hospital in Uppsala, we defined a local competency model for clinical research nurses. Professional development as a clinical research nurse is vital to guarantee job satisfaction and job continuity. As an experienced registered nurse, it is difficult to handle the feeling of limited knowledge and expertise as an unexperienced clinical research nurse. It's a new role with other expectations and limitations. An extended period of introduction is necessary to guarantee patient safety and protocol compliance. And for that reason, a project group of experienced clinical research nurses defined an introductory program to help unexperienced clinical research nurses during a 12-month period. The first year as a clinical research nurse is hard, and many times you struggle with the daily assignments, like handle blood samples and the centrifuge, as you can see here. But our wonderful tutors give clinical guidance, and our coaches in reflection groups establish a safe environment to talk with each other. The introductory program also includes practical and web-based courses, lectures, and an introductory day on local regulations and processes. We ran this program as a pilot project under 2020, and we implemented it at the University Hospital this year. As I mentioned earlier, the clinical research nurse is a crucial member of the research team. Clinical research nurses are delivering specialized nursing care, have highly developed skills regarding trial protocols, research ethics, legislative requirements, and so on. But they are also working long working hours, sometimes in isolation and without professional support networks. So the question is, why we do this when it's so difficult? And the answer is because we love what we do. And the clinical research nurse is so diverse and so exciting. And we all are dedicated to improving healthcare through research. So, what we wish for the future? Um, for the future of clinical research nursing in Sweden, we are working on a national job description for clinical research nurses, and hopefully we can publish it before summer. The next step will be to work on a national competency model for clinical research nurses. We will have the first national clinical research nurse conference this year, which seems to be a milestone in our work. We hope to get an academic clinical research nurse program with a certification sometime soon, and to improve working conditions for many clinical research nurses in Sweden. We are working for a cultural change in healthcare settings, which makes research part of everyday thinking. And last but not least, we hope that the brand new National Clinical Research Nurse Network can provide an environment for learning and exchange. You're curious, you want to know more? So get in contact with the Swedish Clinical Research Nurse Network. You have my email here. And thank you so much, and have a great International Clinical Trials Day.